Hello again, Dr. Peter Montgomery, family practice doctor, uh, giving a COVID update to my patients, friends, and family. Just looking at the data as I see it. If you want to see a doctor's point of view, here it is. Um, this is the Johns Hopkins map of the world with total confirmed cases and deaths. In the bottom right-hand corner gives you the tracking data for the world. And pretty much the initial data was China's data, and then as the rest of the world started getting infected, uh, that started going up again. Interesting thing, always looking for a drop off in the daily increase. I don't know if it's a lack of reporting or testing, but there was actually, for the first time, a significant drop off of new cases in the world. Going to follow that. Trend keeps going down. That's a very positive trend. But I'll get back to why I doubt if that number is accurate later, because I'm really worried about the um, enough testing being done and truthful reporting from many countries, because the numbers seem odd, and I'll show that again later. Cases confirmed. I think that's going to stop being a meaningful thing as we follow actual total deaths. This is the meaningful number. Again, a lot of countries will playing high in the data. That happened with the Spanish flu, and that's why it's called the Spanish flu. Um, World War I was going on. Most of Europe was at war except for Spain. Their press was still free, and they were reporting about all the deaths that were happening in Spain. Everybody was talking about, oh, what's up with that flu in Spain? That must be a Spanish flu. No, actually, it was the Kansas flu that hit at our training centers in Kansas, came over to Europe, spread in the trenches of World War I, where it mutated into a more deadly version, which then, as soldiers went home and left, it spread around the world and did 50 million people died to up to 100 million, depending on how you look at the data. But basically, very terrible. And what we're trying to prevent here again. So, um, looking by country on the cases being reported, the U.S. has been pretty flat here for the past few days. That's very encouraging. Italy had spiked. It was a very bad day there. It's probably 2 days worth of reporting is probably what that is. And they spiked about a week ago and have flattened off, not dropped off. China, again, is the trend we're looking for, where there's a spike. I'm not sure what happened here data-wise, but then a dropping off. Spain, very steadily dropping off of new cases. Now, those are new positive tests. There is a lag of a week or two before people wind up short of breath and be in the hospital. China reported there is a lag from catching the disease to dying of 3 to 4 weeks. So at that point, I'd say from the peak date, you could put 3 or 4 weeks before the pressure is finally off the hospitals. So we still are really into this. This is really the next tough 3 to 4 weeks. Germany's seeing a drop off of new cases. France, the first time, also seems to have hit a peak and it seems to be dropping off. Iran data, it had increased again. They had a second spike. They had a first run up, leveling off, and then a second spike. United Kingdom, finally some dropping numbers there. Switzerland there. Netherlands and Belgium near each other just barely. Here's another mature end of the spike where there's a spike and then a leveling off of cases, but these aren't zero. They're leveling off. Looking up into Norway and Sweden. Sweden's having an increasing spike. Sweden, if you've been watching news, has been intentionally not doing any social distancing, and their numbers are going to show it as we see it here later. Denmark, odd pattern here. Not sure what's up with the recording, but I'd say it's still steadily growing. And here's little Luxembourg on here just to kind of show them on there. They report 21 deaths. Let me just scroll way down to find Russia. Actually, it's easier just picking this number and looking up here in this corner. Russia confirms 1,508 deaths. Huh. Ah, um, a map I find useful is the Kinsa. It's the web-enabled um, thermometer and their map of the U.S. These are the atypical numbers. Here's what people are actually reporting. U.S. worldwide, we had a spike about a week ago. Went on for about a week of rising, now a week of dropping. And we're actually below normal for the years because we are all social distancing. So all infections are decreasing and going down. Still, you can still see hotspots: New York, New Jersey, Pennsylvania, uh, and the area. This is Detroit here down the right hand, over by the base of the thumb, but also pretty much a lot of portions of Michigan and Wisconsin are having issues. Chicago has actually cooled off, a bit of a spot here in western Illinois, and the whole Louisiana, Mississippi, Alabama, Florida section going down in a little bit here in Texas. California staying cool, and Washington staying cool. I feel like the weatherman. Atypical, higher than usual. Again, Washington, where it really hit the U.S. first. New York was hit second. Florida with the spring break infections. The kids have gone home, but the germ spread around has remained. Louisiana's warm, but not cooking hot. Houston's rather hot right now. And Phoenix, Arizona. Southern California is staying very cool. And this is San Francisco here. So that's kind of the U.S. A hot spot in the middle of Kansas here. This is Wichita, Kansas area. About there. St. Louis is staying cool. So the trends in the U.S. is all over down lower because we are doing the social distancing. When we stop social distancing, it will go up. Is what I predict. We'll see how that goes. But the overall numbers are actually pretty good. Now in New Orleans, there's other ways to track it, and tracking actual number of cases is going to be less meaningful. The real meaning is what's happening as far as people dying. For the U.S., New Orleans is having the worst by far as far as deaths per person, per population. Rich in New York is Staten Island, Kings, Bronx, Queens. All these are New York City. New York is Manhattan. Um, and Jefferson County is right next to Orleans County. So a bigger wave, a bigger overwhelming of the health system there. I think more on the news needs to cover that, and more resources need to go down there to help them out. Something is happening very bad in New Orleans. Now, overall, we're doing a better job of testing. The COVID tracking project, again, checking testing. We have been doing 100,000, 100,000, 100,000, 100,000, 100,000 tests a day in the U.S. The labs are swamped with tests. Love to see that number come down, that we're catching up on where we're testing it. But testing is how you predict where this resource is going to be needed. Usually gives you a heads up of about a week or two before hospitals get swamped by patients. We've got behind on that. New York Times is doing a very good tracking of the testing. This is total number of tests done. We've tested more total than South Korea or Italy. As you scroll down, they have another look at the map where, like, okay, but tests per person in the country, we're still woefully behind. We're catching up. We're doing 100,000 a day. We need to get that better so we have a better idea where things are. The CDC and the epidemiologists, they have modelers. They know how many we have based on very accurate mathematical models. But it would be nice to see if we can confirm that. But South Korea and Italy have tested way more per person. In the U.S., here's the U.S. average, and then this is a breakdown by state. All the other lines are all the other states, and showing New York realized the problem and took off with the testing, and they're leading the testing surge, so they know where things are at. Washington State is next. They kind of leveled off. Louisiana has realized they have a problem. They are testing a lot more. They're doing their bit to catch up. All of them above average. California, like I said, on the weather map, they're very cool as far as fevers, but they're definitely bringing up their testing game. So By increasing our testing, we're going to have a better accuracy of what's happening. Sadly, I made myself my own chart because I couldn't find this anywhere on the internet. A per capita death rate by country. So I got all the countries of the world here in order of population, down to about Italy. Then I started picking and choosing a few interesting ones to make a point, and countries that are good reporting and kind of get some more accurate data. China, the biggest country in the world, has a low level of dying. The U.S., we're just getting started. Hopefully, this is per capita, not total. The number of the totals are over here, and I'll do my best to update these for the next couple weeks so we can see the trend. These are a bunch of very, very large countries that either have not infected yet or are not reporting. Some are not reporting at all. Some are underreporting. I'm sure they have strong political reasons for that. Don't mean to make anybody important angry. Just noting some facts here. Iran, despite their closed off media, they're still reporting a lot of trouble. Italy and Spain, credits for being completely transparent and honest, and credit for scaring us terribly what can happen. The rest of Western Europe, France, United Kingdom, Netherlands, Belgium. I'm going to scroll down here, and also my scrolling isn't working. So pardon the lack of fine tuning on the scrolling button. All right, here we go. Denmark. So there's kind of like a middle group here on the level of Iran. France is doing just as bad. Netherlands, Belgium, neighbors to France. Switzerland, again, a neighbor of France and Germany and Italy. Denmark, kind of north of Germany into Scandinavia. Sweden, not doing any kind of reduction. Next door, Norway and next door Finland, opposite, are much lower. I don't have them on the chart. They're much smaller countries. I didn't put them on here yet. Switzerland is a small country, but their per capita is not as good as it should be or could be. Canada is doing a very good job. Poland, very low reporting. Probably has not moved in there much. So it would be wonderful if all the countries of the world would pick up their testing and reporting so we get a better idea of what's going on, so resources can be moved. But like I said, that openness really helps move the resources around. So what we can do, again, I do like to end focusing on the positives. Going to zoom in here to Atlanta, home of the CDC, where they did a very good job of flattening the curve in Atlanta, and Daytona, very nearby in Florida, did not. So the best we can do is try and flatten the curve. We're all either having a decrease of infections or doing much better social isolation. So we all still need to be washing our hands, washing properly, washing for 20 minutes, washing after we touch anything that might be contagious, washing before we touch our face, waving, my word for social distancing. We're waving. We're no longer shaking hands. 6 feet is out jogging today, and with my family as a group, and we were jogging, and other people coming the other way. We crossed the other side of the road and waved, and was everybody polite. I saw a bunch of neighbors having a COVID social isolation party in their cul-de-sac, and they're all sitting in chairs in family groups, but easily 10 to 15 feet apart. And so we're learning how to be social distancing and still get out. The sun was shining. We all need the vitamin D. So washing, waving, wiping down surfaces. It lives long time on surfaces. Not so much if those surfaces are in underexposed of ultraviolet light outside. But indoors, they can last very long periods of time. On paper goods, not so much. A lot of people worry, do they need to wash their packages in mail, it doesn't live very long in those circumstances. So steel and metal and plastic, it lives rather longer. So again, wash those surfaces. And whoa, don't touch your face. If you did touch something, how did it get into you? You touched your nose, your eyes, your mouth, and you brought it into yourself. Very few people have to worry so much about. So, in coughing in their face, although masks are necessary for the medical workers who aren't getting enough, but efforts are being made at our hospital to do what we can and worldwide. I have family members who are sewing masks. So, like the wind, keep that up. We appreciate all the efforts that everybody's doing to try and do that. I saw in Italy they were using snorkel masks as ventilator masks for BiPAP because they couldn't find enough fitting places. I had actually joked around with my family that a snorkel would make a good mask because it would also give you eye protection, and you put a N95 mask over the end. I did a picture of that a couple of weeks ago and showed it to my family, and they all thought it was funny, but they actually see some very clever, sadly, I'm butchering that, but the necessities of mother is what I wanted to say. In Italy, they got very clever and were able to use it, hooked it up to BiPAP, which is a type of ventilator device to help people because they weren't bad enough to intubate, but they didn't have enough face masks for them. So very clever there. Um, but we're doing everything we can. So keep washing, wiping, and whoa, don't touch your face. And keep being the excellent version of yourself. Be as healthy as you can. Get sunshine when you can. Exercise when you can. Fresh fruits and vegetables. Zinc has been helping decrease viral infections. Vitamin D decreases viral infections. And if you are running a fever, not feeling well, coughing, body aches, get tested. The testing is improving. Talk to your doctor who can arrange for testing and get tested. And hopefully, they are doing studies on treatment. Multiple studies around the world are being done, proper testing many drugs in addition to the chloroquine and hydrochloroquine, testing HIV drugs and other medications to find out what's the best drug or best combination of drugs. And thank goodness they have canceled and postponed the Tokyo Olympics because that would have been the equivalent to World War I for us and spreading germs from around the world, mixing them together in close quarters, and then spreading them out to the rest of the world. So stopping that from happening was probably the smartest thing that's happened in this entire um, uh, COVID infection. So I'm glad that people decided not to make billions of dollars, instead held that off, and that was very, very smart and very necessary. So trying to end on an update, positive on the update that things are making headlines. I left it here on the downward part of the map, probably a bit longer. Let me scroll back and show the LA County part of the map and their numbers, and showing just again what good social distancing can achieve: decrease fevers, decrease infections, and hopefully decrease hospitalizations in the coming weeks. So everybody hang in there. Thanks a lot. Bye-bye.